If you have ever had a kidney stone, you remember the pain. It comes suddenly. It disrupts normal life. Many patients say it was the worst pain they ever experienced. But there is a very important truth. Once you develop one kidney stone, your risk of developing another stone becomes high. Many people believe the stone passed. The problem is finished. This belief leads to repeated stones. This video is important for you because today we are talking about kidney stone recurrence prevention. Kidney stones form when substances in urine become too concentrated. These substances stick together. Over time they grow into stones. Kidney stones are very common, especially in adults, especially in hot climates. Most patients focus only on getting rid of the stone. They do not focus on prevention. That is why stones keep coming back. Now let us focus on prevention, because prevention is the most important part. The biggest factor in stone recurrence is low fluid intake. Less water means concentrated urine. Concentrated urine allows crystals to form easily. Water intake should be steady throughout the day. Do not wait for thirst. Urine should stay light in color in hot weather, during physical work, during illness. Fluid intake must be increased. Salt intake plays a major role. High salt intake increases calcium loss in urine. This directly increases stone risk. Avoid adding extra salt to meals. Reduce packaged and processed foods. Salt reduction alone lowers recurrence risk significantly. Dietary habits are very important. Very low calcium intake is a mistake. Normal dietary calcium actually protects against stones. Calcium binds harmful substances in the gut. This reduces their entry into urine. Excess animal protein increases stone risk. It increases acid load. It reduces natural protective substances in urine. Animal protein should be moderate. Balanced meals are key. Fruits and vegetables are protective. They increase natural stone inhibitors. They help maintain healthy urine chemistry. Weight control is also important. Obesity increases stone risk. Regular physical activity helps prevention. Now let us talk about a very important tool. The 24-hour urinary metabolic profile. This test is the backbone of stone prevention. Yet many patients never get it done. This urine is collected for a full day. This shows what is happening inside the body. It tells how much urine is produced, how much calcium is lost, how much oxalate is present, how much uric acid is present, how much citrate is present. Citrate is a natural stone protector. Low citrate increases stone risk. This test helps identify the exact reason for stone formation. It allows personalized prevention. If something is increased in this report, we reduce the intake of that substance. For example, if urinary oxalate is high, we reduce high oxalate foods, like spinach, nuts, and chocolate. If urinary uric acid is high, we reduce excessive red meat and organ meat intake. If urinary calcium is high, salt intake is reduced strictly, not calcium elimination. If citrate is low, we increase fruits and vegetables intake for patients. This test explains why stones formed and what changes are needed. For junior doctors, this test guides targeted prevention instead of general advice only. Repeat testing helps monitor response. It shows whether lifestyle changes are working. This is why recurrence prevention should always include a 24-hour urinary metabolic profile. Now let us correct some common mistakes. Many people drink a lot of water for a few days, then stop. Consistency matters. Some people avoid calcium completely. This increases risk, not reduces it. Some people think one stone means bad luck. This is incorrect. Stones recur due to identifiable causes. Now clear prevention principles. Drink water evenly throughout the day. Increase intake in heat. Reduce salt daily, not occasionally. Maintain normal dietary calcium. Do not eliminate it. Moderate animal protein intake. Increase fruits and vegetables. Maintain healthy body weight. Follow up regularly. Prevention is a long-term process. Now important reminders for junior doctors. Always emphasize prevention. Educate repeatedly. Encourage metabolic evaluation. Stone disease is chronic, not a one-time event. Now let us conclude. Kidney stone recurrence is common, but it is largely preventable. Hydration, diet modification, lifestyle correction, and a 24-hour urinary metabolic profile. These steps reduce future stone risk significantly. If this video helped you, please like the video. For simple and regular education about kidney, bladder, and prostate problems, subscribe to this channel. If you have questions or want future topics, write them in the comments. Share this video with someone who has had kidney stones. Prevention today saves pain tomorrow.